Welcome back to our two-part series on mental health in rural communities. In part one, we explored the challenges of stigma and barriers to care. Today, in part two, we will shift our focus to connection, advocacy, and self care, key ingredients for creating meaningful and lasting change. The phrase connect before we correct reminds us that at the core of any effort to improve mental health is the need for authentic relationships, trust, and community engagement. Whether it's through grassroots advocacy, fostering partnerships, or promoting self care, the path forward is built on connection. Today, we'll discuss how rural communities can come together to address mental health challenges, advocate for change, and ensure that those working on the front lines take care of themselves. This conversation is about more than addressing challenges, it's about embracing the strengths and resilience that rural communities already have. It's about embracing the strengths and resilience that rural communities already have and building on them to create a brighter future. Today, we are joined again by Ms. Angie Williams, a peer support coordinator with Aspire Behavioral Health and Developmental Disability Services. Ms. Williams is a certified peer specialist parent who works diligently with individuals and families who are experiencing the first episode of psychosis. She is a certified trainer in QPR, question, persuade, and refer, suicide prevention, and youth mental health first aid. Miss Williams enjoys practicing self care and, in her own words, because at the end of the day, how can we as helping professionals, caregivers, parents, or whatever role we identify with, pour from an empty cup? It is during this time when I tell my tough to keep on going. Welcome again to part two of our podcast on rural mental health, which is entitled Connect Before We Correct. Welcome, Angie.
Hello, everybody.
Thanks again for joining us today. It's so great to have another conversation with you about this important topic. And as we did in part one, I'd like to start this section also with an icebreaker question and ask you to respond to the following. What does connect before we correct mean to you in the context of mental health?
So, connect before we correct. Um, I just want us to think about this from day to day. We, as individuals, in whatever role we play, we might just be the only hope that somebody see. And with that being said, somebody's expecting for us to clock in, and somebody's expecting for us to clock out. So even in the midst of both of those things, we want to let individuals know that we care about the things that they care about. So if we can meet people where they are, then we have greater success stories. So again, that connection piece is more important than the correction piece any day.
Absolutely. Thank you so much. That was very well said and clear that the connection piece is really important before we try to do anything as far as helping others. We have to connect first and build that rapport. I really appreciate that. So let's move into the first segment of our discussion today around community engagement. And I'd like to focus on this concept of building trust. And my first question for you, Angie, is why is trust building so critical in rural communities when addressing mental health?
So just speaking from our end and even the aspect of our location where we actually provide the services, we want to establish a place of safety. We want to establish that connection of safety for people because I know in the last segment I was talking about, we as individuals who are trying to navigate the system, we hear so many no's along the way. We, at some point in time get the strength and the um, wherewithal that we need to create a yes. So just being able to be in a space, in a place to where you can establish that trust for people makes people want to come and receive services. And I even, mention the location. And I tell people all the time when they come to our location, we're not serving hospital, we serving hospitality here.
Hmm. Wonderful. And I'm so excited that you brought in, that piece from our first segment about just creating the yes. I really love that. I've been thinking about it a lot since we last met. So I'm happy that you brought that up again here today. So we want to dig a little deeper into this concept of building trust. Let's shift it to organizations now, and I'd love to hear your thoughts about how organizations can engage rural communities in meaningful and sustainable ways.
Don't just show up. A lot of people, just kind of get kudos for showing up. But at the end of the day, who is that really helping? Yes, we want everybody at the table, but when we show up, let's show up with some solutions. We got a lot of problems out here, and especially in our rural areas, we can always find something that's wrong. But let's talk about the things that are right. Let's talk about the things that are going well. Let's talk about how we, as agencies and community partners, can be forerunners for the things that the people need in the community to help our community be better.
Hmm. Absolutely. And I can imagine that when we're talking about organizations and creating meaningful and sustainable connections, I can imagine that connection piece and that trust building piece plays a big role in that. What do you think?
It does. And I make a statement all the time to a lot of our community partners, and that is, sometimes we don't get in a hurry, or we don't want to do anything about a situation until our forest on fire. It's all good when somebody else's forest is on fire, but when mine catches fire, I need to have some solutions. I need to have some people on hand that can help me get through my process. And so a lot of times we have to remind people, let's go beyond, agency. Let's start individually. We have to remind each other that at the end of the day, we're just all one situation away from being in a crisis situation. So, let's treat people how we would want to be treated, or how we would want our family members to be treated. And so this also helps contribute to that trust factor, and just having the meaningful and sustainable ways of servicing our families in our communities.
Hmm. Absolutely. Thank you so much for sharing your thoughts about building trust. And then another component that I'd like to uh, discuss with you today is regarding community-led solutions. And you mentioned earlier that when organizations or even individuals show up with solutions. That's what you said. And so when we're thinking about community-led solutions, can you share an example of a successful community-led mental health initiative which you've been a part, or maybe something that you've observed in your community?
So I think I mentioned in the last segment that we talked about, one of the things that we are facing in our community is with our housing situation for a lot of our individuals. Those individuals with mental health challenges, our parents of youth or young adults with mental health challenges. It's just a lot to navigate all of these things, and to almost be homeless or be homeless on top of that. That is a lot. That is so many details in the midst of trying to help a person navigate this system. So I can say, one of the meaningful partnerships that I've had the privilege of connecting with is our housing authority. And she and I have had such great success in that arena of helping our individuals get homes. It has just been mind blowing, as far as how many people we put in homes. And I know we are up to about 250 now, over the span of a year and a half. Let's just say that at the most. But that's a large number of individuals who actually needed housing, So they'll be able to receive services, whether that's from us on this end with mental health or educational services. So just to be able to be in the midst of those success stories, I mean, is a job well done, if I say so myself.
It's an excellent job, well done. I was blown away in our last segment when you shared about the housing authority and then the ability to provide housing for that many families. And I was especially struck because in the small rural community, that's a lot of families. And I think I even said that the last time, that to be able to do that is amazing. And do you think that because it was community led, that it was so successful? I mean, and I know that there are a lot of different initiatives that are led in different manners, but to be community led, what impact do you think that had on it?
Yes, being community led, and not only just being community led, but for us to be, again, some of the forerunners in the community, always at the tables with any community partners who are having meetings so that we can advocate for our families. I think that that had a big part to do with it as well. And every time the doors are opening for us to meet, we're always there. You know, some of us are the face of our agencies. And because we, always try to promote the yes, we can get the job done. And that helps a whole lot.
Yes, excellent. And that sort of leads us into the next question because you brought up advocacy. What role do peer support specialists or local advocates play in creating change? And you sort of alluded to some of this, but could you go a little deeper?
Lived experience is everything. And we have this saying that we live our recovery out loud. You know, whatever that lived experience may be, we live it out loud. You know, we let people know that at the end of the day, we say all the time that there is light at the end of the tunnel. But for a person who has been in darkness for so long, some of us have to carry the torch middle ways. We can't wait till we get to the end of the tunnel because somebody might not have that time frame of making it to the end of the tunnel. So, can we, again, be somebody to somebody and meet them where they are?
It's so interesting that at the very moment that you were saying meet them where they are, I was thinking those exact same words in my head. And it was just a great synergy that you said it and I was thinking it because I was just imagining the individual trying to get to the finish line but only able to get midway. And it's like, yes, this is what we need to do as mental health professionals working with these populations and individuals and communities and meet them where they are. It's really important. So I'm happy you said that. So let's move now to the last segment of this topic around community engagement, and that is about leveraging strengths. What strengths do rural communities have that can support mental health initiatives? Let's talk about strengths for a bit.
Well, I can say that, for us on this end, we're stronger in numbers, because we know the more that we have, the more resources that we have. We know that if we can continue to have these conversations, if we can continue to talk about the realistic approach, then we just kind of build on that. And not only that, I mean, each agency, we help each other. I can't say that's the great thing about being in the rural communities. Again, everybody know everybody. We cross each other paths more than one time during the course of the week. So just being able to have that partnership and establish new partnerships that may come through the city or the community, I mean, it's golden. I mean, it is just so great to be able to be a part of something when we know we see the results and we can get the results. And I can say this also, um, even with us creating the yes that we want to see with our community partners, we hold each other accountable. Oh, we hold each other accountable, and sometimes, some of us as community partners, we might fall by the wayside for a little bit, but sometimes we need a reminder to let each other know that, hey, you got this. We got what we need to help the families that are in need. So, what do you need me to help you with so that we can help the families that we're serving?
Absolutely. Absolutely. And, I found in the work that I do in rural communities that community partnerships is everything. Like, we wouldn't achieve the success that we've achieved without those strong, long standing, sustainable partnerships that are nurtured over years. I mean, this is like a long term relationship. And so those partnerships are critical, I've found. Hmm. One thing that I want to talk about is, um, we have a lot of, in our training, we learn about all of these interventions that we can use to develop and implement initiatives and things like that. But sometimes I don't want to say we forget about it, but we don't integrate other things into our work that are just as powerful and meaningful. So, my question to you is, how can cultural traditions and community values be harnessed to promote wellness in rural communities?
So, again, that's where our community partners come in at. Um, some of us work in different platforms, and so we will have um, different traditions with some of the community partners that we affiliate with and the different families that we affiliate with. So I think that using our platforms is the greatest asset that we have to be able to do so, not just using our platforms, but recognizing those leaders in the families that we're serving so that once again their voice can be heard over the course and during the course of them being with us as we're servicing them. So, again, just letting them know and encouraging them that, hey, this is not the end all be all. We see something in you and in your family, the resiliency that you all have, and we want you to be able to share your story in the midst of all of the community partners and in our community.
Hmm. Excellent. Excellent. Do you have an example of a time where a cultural tradition or a community value was integrated in an intervention or something that you used with an individual, a family, or even like a community group? Do you have an example that you could share with us?
So I can talk about one of our families, and she and her mom was trying to navigate the college sector here. Here in Albany, Georgia, we have Albany State University, and just being able to navigate through that and taking a course of actions that she had to take just to re-enter um, school and being able to be what she wanted to be in that moment, but she used our platform to do so, you know. And we could advocate for her in her work, so much so to where she felt the confidence that she needed to go to school, be successful in that arena, come back to us and say, hey, I have gotten all I can get from Albany State University. Now I want to transfer to Kennesaw State University. And I'm like, what? Girl, you do it. And just being able, again, to see the fruits of our labor, to be able to be in that place, in that space where we created that space of safety for her. We created the space for her to share her story, her testimony, created the space for her to let people know, hey, I have a mental health diagnosis, but my diagnosis don't have me, and continue to move forward. I mean, hey, we celebrate that all day long.
I'm celebrating right with you. That's a powerful story, and I appreciate you sharing that. You have the best stories that just create these vivid images that sort of stick with us. So I really appreciate you are a storyteller. Well, Angie, thank you so much for engaging in this discussion around community engagement. And now I'd like to shift gears and talk a little bit about advocacy in more detail. So let's talk a little bit about advocacy and the work that we do in rural communities. In the first piece of this discussion, I'd like to focus on raising awareness. What are the most effective ways to advocate for mental health resources in rural areas?
So, with any agency, we know that numbers are always good. Okay. Everybody is somewhat data driven, because the higher ups want to see the numbers. And we do provide that. But here at our location, we like to do climate surveys with our community partners. And we send those surveys out to our partners because we want to know what it is that we can do better. Um, Again, we can always hear about the things that we can do better. And we also want to know what we're doing right.
Sure.
Also, just hearing about our individuals with lived experience. We hear the saying, seeing is believing. We want for our individuals to be able to share their experience with us or in the rural areas, and also let, again, our lawmakers, our people that sits up at the Capitol know that this is what we need and we need it now, you know?
Mm-hmm. Absolutely. And you literally just addressed my next question regarding raising awareness, and that was really going to be about how storytelling and lived experience and those narratives influence change at the local or policy level. And you actually touched on that. And I know that in some of the work that we've done, just those stories, just hearing those stories really move people, and it brings about change, policy change on numerous levels. And I was really curious about some of your experiences with how those narratives and storytelling and just sharing that lived experience influence policies on local level, regional, national. If you have some stories you can share, or just some information that you can share about what that looks like in your community.
So even with our storytelling, even if we don't have the individual, with us in person, some of them we try to have in person. But for those that we can't have in person, we do videos. We do like small little documentaries, of our families who have just been through the system and living again their recovery out loud. And that is a atmosphere that we create here in our community, that people get to live their recovery out loud. And we advocate and let people know that recovery belongs to everyone. And again, sometimes people need to see people who look like you as a representative so that they can continue to do the great work that they're doing.
Mm-hmm. Yes, stories are definitely powerful. And I like what you said earlier about the numbers, because we need both. We need the quantitative data and the qualitative data, yeah, to make a huge impact. Okay.
Yes. And also, to go along with that, and I mentioned it in the last segment, our leaders, our CEO Dana Glass, and our deputy director Lisa Ostavine, they don't mind going to Atlanta, to the Capitol, knocking on Representative Gerald Green's door and sitting down and talking to him one on one about the needs of the community as it concerns mental health here in Albany, Georgia. And I love that about them.
Yes, I remember you sharing that in our last segment, and I remember how powerful your words were, and like how it really makes a difference that they're really to go out there, boots to the ground, and get it done, and get whatever you all need to do the work that you're doing.
Yes.
Yeah. That's wonderful. So, I know we talked about community partnerships in the last segment on community engagement, but if we think about partnerships and collaborations with regard to advocacy, how can rural mental health advocates partner with schools, local businesses, or other organizations to amplify their efforts?
So again, I just mentioned the numbers. Um, when we're dealing with the different sectors in our community, we show the need and we present the solution.
Mm, mm. Oh, yeah.
Because again, at the end of the day, we're working with the same families. We know the issues that all of us have because again, we're working with the same families. And so we go in with the concept of this is what we need and we're here to provide the need.
Wow. Wow. So then, if I'm understanding you correctly, it's like, and it goes back to you earlier mentioning being solution focused. So you don't just go in and present the need; you present the need and the solution.
That is correct.
I love it. I love it. I love that. Oh my goodness. I love that.
That is correct. That is correct. And so when we show them that and we show them that this is working with where we are, we can also extend this to where you are so that we can come together and make this better. So we have the foundational piece. Now we're building, you know, and to continue to build, we might have one house and now we working on another one. So again, just to be able to see the outreach that we can have in the community if we just get one yes and a solution to that problem that we may have in the community for everybody else to get on board, then we have a whole community of wellness.
Absolutely. And it sounds like your work is community led, solution focused, and grounded in data. And that data is not one sided, it's qualitative and quantitative.
Yes. Yes.
Awesome. That's wonderful, Angie. Um, so let's shift it just a little bit more here and talk about the role that policymakers can play in advancing rural mental health advocacy. What are your thoughts about that? What can policymakers do?
Well, the policymakers, they are definitely a voice for our funding, especially for us boots to the ground. And just being able to come outside of the four walls. We've had some of the policymakers to come outside of the four walls to visit locations to really see the great work that we're doing. Not only to see the great work that we're doing, but to actually hear from our families and our community partners to, just kind of be one on one with them and ask the hard questions and also present what is needed for this community. So that's one thing that I love about our lawmakers is that we have some that are not afraid to come outside of the four walls and really be boots to the ground with us and know the challenges that we may have and want to bring the solution with them.
Hmm. That's wonderful, and it reminds me the image that popped into my head when you were talking is that I know in our first segment we talked about how it's important for us as mental health professionals and those working with individuals and families and communities to come outside of those four walls. And what you're saying now is that it's also important for these policymakers to also come outside of the walls to see what's happening in the community. Hmm. Hmm. Wonderful. So we've talked about raising awareness. We've talked about partnerships and collaboration with regard to advocacy. And I know for a fact, because I've experienced it in my work, that in the process of raising awareness and building these partnerships and collaborations, we often face resistance that we have to navigate. So I'd like to shift our focus a little bit in talking about navigating that resistance. And my first question for you, Angie, is what strategies can advocates use to overcome resistance from individuals or institutions?
One thing I like and I like to participate in is open forums and panel discussions.
Mm-hmm. Yes. Oh, yes.
Let's fill the room. And let's have these questions. Again, some of us might have hard questions that we have to answer. Sometimes we might not have answers to some of the questions, but again, that get everybody in the room attention. It get our wheels turning. It gives us a place to start to fix whatever problem that we might have, or um, bring forth again the solution that we need. So sometimes we don't know what we need until we're in the place of needing it. And so to be able to sit at the round table, to sit at whatever table that you're invited to share these things that we need to share as far as it concerning our communities and how we better that community, these two things are huge. Also, just being able to educate our community on what it looks like, feel like, for those individuals who may have mental health challenges, and how important it is for us to come together for our families, because again, we service the same families.
Mm-hmm. Exactly. Yeah.
And to put the cherry on the top, because we're going to have all of these resources and all of these things on hand, but the cherry on top is showing success, showing that individual with the lived experience who live in their recovery out loud to come out and share with people how they came from one side of the table to the other side of the table, to be able to be in front of them in that moment to share their story.
Yes. That's wonderful. And the themes that emerge from what you just shared, Angie, are the importance of strategies like effective communication, open communication, um, education, and then just sharing those success stories. That gets people motivated.
Yes. Yes. And a lot of times, we also, invite people from um those different organizations to even share their personal stories. And a lot of times, I might do an icebreaker and start our sessions off with, how do you feel? And you know how we give the age old answer, good, I'm all right, I'm fine, blessed and highly favored.
Yes.
But then when I ask the question and I tell them to write it down, how do you really feel?
Mm, yes.
Don't put your name on it. Just tell me how you really feel.
Yeah. How you really feel.
And then when I'm going down the list of how people really feel, this is who we are sitting in this room and we feel like this. So imagine what our families feel like who don't have the resources that we have on a daily basis. So again, just putting the mirror in our face so that we can see who we are, where we are in the areas that we're struggling in, so that we can identify with the parents and the families that we're servicing on a daily basis.
Absolutely. That's a powerful question. You said the same thing, but you just worded it differently. Like, how are you feeling?
Yeah. How do you feel?
But then when you ask how are you really feeling, it causes one to pause
That's right.
and dig deep, and then there's a cognitive shift that happens where you really have to figure out how to answer that question, and that's a powerful question.
Yeah. Not only are we working to strengthen one another on the inside, we also have the hard conversations. We have to have the hard conversations because it starts with us. I mean, if we're not where we're supposed to be agency wide, how can we expect for our community to be better? So just being able to again have those hard conversations within, and not only just having hard conversations about what's not working well, but again giving praise reports of the things that are working well within our agencies, and encouraging each other. I get a chance to go to the housing authority and tell them that they are amazing and they do amazing work in our community. I get to go to the schools and tell them how appreciative we are of them for working with us, partnering with us so that we can see our families be at a place of wellness. So we get to have these conversations, and we also get to praise each other for the great work that we're doing in the community.
Absolutely. And in your role, as you're working with individuals and families and even community groups, how do you know, like, what are the signs that you get when you know that your work is inclusive, that individuals, families, communities feel like they're part of the process and that their voices are being heard? How do you know that that's happening in the work that you do? What are the signs?
People show up. Not only do people show up, when they call your community name, when they call your agency name out there, you just hear all the good things that people have to say. We actually had a community forum here at Aspire, and we invited parents and community partners to come so that we can listen to what it is that they had to say about us, whatever that was, positive or negative. We wanted to hear it. And again, to be able to create that space for them to come in and share their experience with us, that just makes us better. And so when they show up and when they have those good things to say, even when they show up and don't have such nice things to say, guess what? They still showing up, and they believe in us to know that whatever the problem is, that we will change it for, the better of their family and the people, other people that we're servicing. So that's always a great thing for us.
Yes, I can imagine. I can imagine. All right. Well, thank you so much, Angie, for the discussion around advocacy. And now I'd like to move into the last segment of our discussion today, and that's around this concept of self care, which I'd like to refer to as cultivating care moving forward. Yes,
All right.
because I think it's so important. This is you've described over, the first segment and then this segment, a lot of work. It's a lot of work. There are a lot of moving parts. There's a lot of needs that need to be met. There's a lot of boots on the ground. There are a lot of knocking on doors and just a lot of work. But it's important work and it's work that we're passionate about. But at the same time, we also need to think about how do we care for ourselves and others who are doing this work. And so that brings us to this topic of cultivating care. And the first part of this is where I like to really focus on sustaining mental health workers and advocates. So my question to you is, how can mental health professionals and advocates avoid burnout, especially in rural settings with limited resources?
You know, Sometimes that question is a little hard to answer, because we know that post COVID, and we're still in it a little bit. We're still having some COVID cases.
Hmm. Sure.
The workforce has just been so slim, and that causes some of us to have a lot more on our plates than others.
Yes.
And even with that, we still have to be at a place where we can communicate that. And I love that, again, and I don't know how many times I've said this about our leaders and our leadership. Um, they allow us to communicate to them freely. They allow us to say the things that we need, the things that are working, the things that are not working. And yesterday, they sent out a climate survey for all of the workers to see where we are, what we need to do better, whether that's from um, more money, what are the tools that you need at your specific locations, what do you need for your supervisor to do to help you through whatever transition it is that you're going through. I just love that we have some listening ears up top that want to make sure that we have what we need so that we can be okay and continue to service the families that we're servicing. It's not one sided, you know. And I think that's the one thing that helps us to be able to provide and perform to the level that we are performing in our community is because, again, our leadership cares about the things that we care about also.
Wow. Again, very powerful. And it sounds like they sort of follow the servant leadership model.
Yes, yes.
And let's shift and focus a little bit more on you. What cultivating care practices have you found effective for yourself or, or even for others? But I would love to hear, what do you do to cultivate care, the important work that you're doing?
At one point in time, with me working here, I wanted to make sure everybody else was okay. And then at a point in time in my life, I had to have a hard stop and advocate for my own self and be okay with it. And so, I love calendars. I have all kind of calendars. I'm old school. I like to write in my calendar. I know a lot of people like to use their phones, but I write in my calendar. And so, with my calendar, I have a lot of things scheduled. And this one particular day, I just decided that I was gonna schedule me on my schedule. And with me scheduling me, a lot of times we have that saying, pencil me in. No, I'm not penciling me in. I'm going to use a Sharpie. I'm not erasing this. I am going to schedule me because at the end of the day, it is necessary. I can't do the great work that I need to do if I'm not at full capacity. And so I know now how to advocate for myself. I tell my team, hey, y'all, I got to tap out, tag you it, because I have to step back, regroup, so that I can continue to do the great work that we're doing.
Mm, wow. I think we all need to invest in a Sharpie.
Oh, yes. Look, I got them in all colors.
I believe that too. I believe that. Oh, yes. I think that's another powerful image of yours where it's like, this is a non-negotiable. We have to do this. We have to do this for ourselves.
Non negotiable. No. And I tell my team all the time, we have to come from behind the line and get in the front of the line. You got to have, some of us got to have these same services that we're giving to somebody else. And again, I can tell you, our leadership, they listen. So we have services through our agency where we have, I wouldn't call it free services, but we have a certain amount of services that we can get from an outside agency because I have a therapist
Mm, mm, mm.
on my agency. They are listening. So they allow us to have these sessions with therapists. They allow us to have coaching sessions with people as well so that we can maintain our mental health so that we're able to continue to service the families that we service. Again, hey, I might work in mental health, but I also got a therapist as well.
Wonderful. That's a tremendous resource and a necessary resource. It should be required because this is real work, and it requires a lot, and we have to take care of ourselves to, like you said, do the great work that you're doing. Yeah,
Yeah. And again, I get to tell people, if I'm going to be the example, look at what I'm doing and look at what I have to do for me.
exactly. Be the example.
So I'm not just telling them to go and do something, I'm actually doing it myself as well.
Be the example. Wonderful. So we've talked about this cultivating care on an individual level. Let's talk a little bit about it more with regard to promoting community wellness. Um, and how can rural communities foster collective care and support for one another?
Um, I I have a group that I'm in with some of the community partners, and we meet virtually every Monday at 10 o'clock just to do a check in.
Hmm.
So, and we pick, or somebody may volunteer to do it one Monday, somebody might volunteer to do it another Monday. But at the end of the day, we're coming together, we are filling each other's cup, we are doing the check in, we are being intentional about checking in with one another so that we can be who we need to be for the community that we're servicing. And so I love that. I mean, we can't wait till Mondays come so we can just click on and have our sessions that we need so that we can start our week off on a great note. So again, we got to create the thing that we want to see. And that's what we did as community partners.
Wonderful. So you're doing it amongst yourselves, and it really ties into the topic of what we're doing today. This connect before we correct. So you're connecting with each other, and you're connecting with individuals and families and the community before you go in with interventions or anything else. You're connecting.
And it also helps us to not only see each other as a partner, we see each other as a person, a whole person. Yes.
Oh yes, that's a whole person. And when I this hadn't occurred to me before, Angie, but when I asked you this question, the image that popped in to my head was something that you shared with us during part one, when you were telling us the story about the woman. I think she was in the middle of the street, struggling, and then the family just sort of pulled up some chairs and started recording.
Yes.
And so, if we were to think about that situation in the context of this question regarding fostering collective care and supporting one another, how would that situation have been different if that family had this knowledge about cultivating care for one another, fostering collective care, and supporting one another? What do you think that would have looked like?
Well, I mean, I think that instead of them pulling those chairs out looking, they would have been trying to, assist in whatever way they could. Um, and wanting to know how can they be an advocate for that individual who was in that crisis situation. And I wish that we could do more of that. And we can do more of it. Let me not say I wish that we can do more of that because we are the solution. Because I know that, again, I was going to be posted on somebody's social media platform. I could use that also as a platform to advocate for our individuals who may be um, in a mental health crisis. And so we use our platform for things as such and be the voice for those who don't have a voice in that moment.
Thank you so much for summing that up in response to something that you shared earlier that applies to what we're talking about right now. And I would love to wrap this section up by just asking you an overall question about the role that cultivating care can play in building resilient and thriving communities. What are your thoughts about that? Just overall, how cultivating care can just build our communities up and make them resilient and thriving.
I heard this saying, and I take this to heart. Um, I want to give the families that I serve in our community the best of me and not what's left of me.
Mm, 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 mm. I'm gonna have to write that down, Angie. So keep talking. Yes.
If I can give the community the best of me, see, I tell people all the time, this goes beyond a paycheck. And, we mentioned it in the last session that this is not hard work, this is hard work.
Hmm. Yes. Yes.
And just being able to, promote wellness for the worker is huge. People say we can't pour from an empty cup. But I heard somebody say that, hey, what's in the cup is for me. It's the overflow for somebody else. And I'm like, ooh, I like that. Ooh. So that puts me in the space of making sure that I have what I need so that somebody else can get the best of me as well.
Yes. Yes. Wonderful. Wonderful. Okay. We're gonna wrap us up now, Angie. This has been a wonderful, thoughtful, meaningful discussion. And just like we did in part one, I would love for you to share one key takeaway that you hope our listeners gain from today's discussion on connecting before correcting.
At the end of the day, and I want us all to be mindful that um, you might be the only hope that somebody see. You might be the only hope that somebody hear. And we, as helping professionals in whatever arena, whatever area that is, we need to make sure that we are okay and know that it's okay to not be okay. Somebody just need to know it.
They just need to know it. Hmm. And if our listeners were interested in getting involved and supporting rural mental health advocacy, what are your thoughts about the best way to do that?
Again, start sitting at the round table. Start going to our local meetings that we have. I know that in certain areas it's different, for certain people, but I mean, start linking up with the community partners to see what the need is. Go to your local mental health establishment and see what the need is, to see how we can use our platform to be advocates, not only just for the individuals that we serve, but also for the agency. Some of our agencies need advocates. So again, we got to be able to be boots to the ground and sincere about the work that we're doing, because if we don't advocate for us, then who will?
And who will? And what a great way to wrap up part two of our discussion. And I'm just so honored to be able to sit here with you, Angie, and have this discussion about a topic that I know we're both very passionate about and have spent our careers working in rural communities. And I just appreciate all of the expertise that you've shared, the stories, the images, the gems, everything has just been wonderful. And we started our discussion in part one talking about we're doing the heart work, where we focused on mental health stigma and barriers to rural communities. And then we wrapped up today. We're talking about connecting before we correct. And we went into this concept of community engagement and advocacy and cultivating care. And it has just been a lovely discussion. And I hope that our listeners are able to take something from this and apply it to the work that they're doing. But I just want to thank you from the bottom of my heart for your authenticity and the wonderful work that you do and the passion that you bring to this work and the lives that I know you have changed by doing this work. And I wish you the very best. I know that you will continue to cultivate care for yourself so that you can continue this work. And I truly thank you for the time that you've shared with us.
Thank you so much. Thank you so much for having me. Thank you so much.
It's our pleasure. You have a wonderful rest of the day, and we wish you the very best in your career, in your personal life, in whatever you choose to do.
Thank you.